Matisak for the Philadelphia Department of Public Health. It's always wise to practice the basics of good hygiene, those tips our mothers taught us. Wash our hands often and cover our mouths when we cough. Never is that advice more important to remember than when a flu pandemic threatens our community. Illnesses like influenza, what we commonly call the flu, are caused by viruses that infect our nose, throat, and lungs. Flu germs are easily spread through the air from one person to another when an infected person coughs or sneezes. Sometimes the germs are spread when someone touches a desk, doorknob, or other surface contaminated by an infected person. Flu viruses may also be spread by a person who is infected but has not yet become sick and doesn't realize that they can spread the virus to others. This is why it's so important to practice good hygiene by hand washing and using tissues to cover coughs and sneezes. During a flu pandemic, a global outbreak caused by a new influenza virus, it is particularly important to practice good hygiene to decrease the spread of this serious illness. It's up to all of us to take the necessary steps to prevent the spread of disease and help to protect the health of others around us, at home and in the community. So what exactly can we do to lessen our chance of getting and spreading an influenza virus? Here are some basic steps. Cover your mouth when you cough or sneeze. Wash your hands often with soap and water. Avoid touching your eyes, nose, and mouth. Stay at home when you are sick. Stay away from people who are sick. Get vaccinated if that option is available. In contrast to seasonal flu, pandemic flu is caused by a virus that is new among humans. Most of us will have little or no immunity to the new virus, and vaccines probably won't be available. Because of this, the virus will spread very easily from person to person. That's why practicing good hygiene and limiting close contact with others who may be infected is so important in minimizing your infection risk during a worldwide outbreak. You can help stop the spread of germs in a pandemic by taking these basic steps. Always cover your mouth and nose when you sneeze or cough. Use a tissue to cover your mouth and nose and then throw the tissue away. If you don't have a tissue, it's best to cough or sneeze into your upper sleeve rather than your hands. Clean your hands after coughing or sneezing. Use soap and water or alcohol-based hand cleaner. Repeat these steps every time you cough or sneeze. Clean your hands often. When available, use soap and warm water and rub your hands together to scrub all surfaces. Wash for 15 to 20 seconds. That's about the same time it takes to sing the Happy Birthday song twice. The soap combined with water and scrubbing is the trick to removing germs. If you don't have soap and water, use alcohol-based disposable hand wipes or gel sanitizers. Rub the gel into your hands until they are dry. The alcohol in the gel and wipes kills the flu germs. Avoid touching your eyes, nose, and mouth. Germs often spread when you touch a contaminated surface and then touch your face. Germs can live on surfaces for several hours, so clean contaminated surfaces with alcohol or other disinfectants. Stay home when you are sick. If you begin to feel flu symptoms, stay home, get plenty of rest, drink plenty of hydrating liquids, and check with your healthcare provider if needed. Remember to keep your distance from other people to limit spreading infection. During a severe pandemic, people who live in the same household as people with the flu may be asked to stay home since their chance of getting sick is increased. Avoid crowded conditions and close contact with sick people. Limiting the time you spend in public during a flu pandemic will lower your chance of becoming sick. If going into the community cannot be avoided, wearing a standard face mask may provide a protective barrier from others who are infected, coughing, or sneezing. Once masks have become wet or dirty, throw them away and wash your hands after you handle a used face mask. Public health officials will issue more information about when and how to use face masks when a pandemic occurs. If you or someone close to you gets sick, here are some of the symptoms you should look for. High fever, headache, extreme fatigue or tiredness, coughing, sore throat, runny or stuffy nose, muscle aches, nausea, vomiting, and diarrhea. During a pandemic, how can you take care of a sick family member or loved one while also protecting your own health? When in close contact with an infected person, it's important to protect yourself and other household members from becoming sick. Here are some basic steps that you can take to stay healthy while caring for someone at home who has the flu. Separate the ill family member from other people in the household. Avoid eating and sleeping together and avoid sharing a bathroom. Wash your hands after touching someone who is sick, particularly if you come in contact with body fluids like respiratory secretions, urine, or feces. Give sick people a face mask to wear when they are around other people. If they are unable to wear a face mask, then the people caring for them should wear one. Don't share eating utensils, towels, or bedding with infected people. Others can use them after proper cleaning with soap and hot water. Again, public health officials will give more specific guidelines for using face masks and caring for sick family members as more is learned about the next pandemic flu virus. The timing and severity of the next flu pandemic can't be predicted, but one thing is certain: using good hygiene techniques will slow the spread of infection and help keep you healthy. Don't wait until a flu threat is real to start practicing good hygiene. These techniques are a good idea anytime. If you want to know more about protecting yourself and your family during a flu pandemic, visit www.fila.gov/health or www.flu.gov.